Welcome to Khazanah Research Institute's webinar on the State of Households Report 2024, called The Households and the Pandemic 2019 to 2022. This is a 4-chapter report, and this webinar will be covering each of the chapters in turn. Chapter 1 will be focused on shifts in the pandemic, how COVID-19 reshaped household formation, income distribution, inequality, and wealth in Malaysia. Chapter 2 will focus on from necessities to new norms, how COVID-19 reshaped household expenditure in Malaysia. Chapter 3 looks at from blackboards to broadband, education outcomes and digital learning during COVID-19. And concluding, we will have Chapter 4 on health and digitalization, solutions for the pandemic and beyond. Each of the 4 chapter co-authors that we will present today will also explore potential policy solutions to each of the problems that have come up during the pandemic years. So we'd like to begin with Chapter 1, Pandemic Shifts, looking at income distribution. Take it away will be Shazrul Arif Suhaimi, one of the co-authors for Chapter 1. Please take it away, Shazrul.
Thank you, Shalom. Since 2009, Malaysian household incomes have showed modest growth, but was slowed by the COVID-19 pandemic. Despite the increase in household income in 2022, it grew at a much slower rate compared to the pre-pandemic trend, remaining significantly below potential projections. The overall compound annual growth rate across 2009 to 2022 for real mean income was 3.8%, whilst for real median income, it grew at 4.3%. From 2009 to 2022, the real mean income grew from 4,600 ringgit to 7,500 ringgit, whilst the real median income increased from 3,200 to 5,600. The lowest income growth that we saw was actually observed during the 2020 to 2022 period, reflecting the economic challenges that we faced as households were impacted both nominally and in real terms. Specifically, median income was 12% below pre-COVID-19 trajectory, and mean income was 13% below. So there was a substantial lag in the recovery. Additionally, potential trend lines indicate that the mean income is growing at a slightly faster rate than the median income, suggesting more rapid income growth at higher income levels. This is demonstrated by the widening gap between mean and median incomes and suggests increasing income inequality where higher earners experienced greater income growth compared to the rest of the population. Next, we looked at inequalities. So the adjusted household income is a function of both the mean household income and the Gini coefficient. The Gini coefficient is a measurement for income inequality. So at the national level, whilst Malaysia's adjusted household income rose for both the 2016 to 2019 period, as well as the 2019 to 22 period, the growth in 2019 to 2022 was markedly lower, generally due to the smaller change in mean income. So despite the higher change in mean household income, the 2016 to 2019 period experienced an increase in inequality, represented by the increase in the Gini coefficient, whilst the 2019 to 2022 period saw a slight decrease. However, the use of the Gini coefficient alone is not sufficient to assess the inequality, where some states and some strata showed a reduction in Gini, but an increase in inequalities at the tail ends of the income distribution. Next, we looked at wealth and savings for households. So although there are no official statistics that capture the complete landscape regarding household savings, we can use household residual incomes as a proxy to represent the flow of money that is channeled into household savings. So the pandemic disproportionately reduced the residual incomes for lower income households. And when we look at the graph, the bottom 10th decile, represented as D1, experienced a 108.2% decline from 200 ringgit nominally in 2019 to negative 16 in 2022. So these are the individuals that are reliant on government relief programs. This trend persists across from D1 to D7, which experienced a mean residual household income reduction. However, when we look at D8 to D10, there is positive growth where it gets progressively higher from 2% in D8 households to 6.6% in D10 households. This is consistent with global trends whereby the pandemic did have a negative impact for lower income households and it increased the inequality that is present between the rich and the poor. This trend is further worsened through COVID-19 related EPF withdrawal schemes that collectively resulted in 145 billion ringgit being withdrawn by members.
Well, thank you, Shazrul. It's a very sobering look at the impact of the pandemic, particularly on lower income households, and it raises the specter of economic scarring and households perhaps are yet to recover. So what can policymakers today make light of in terms of these conclusions coming from 2019 to 2022?
Mm-hmm. Thank you, Sherlock. So number one, instead of focusing on income or consumption, we understand that poverty itself can be multidimensional. So we recognize that poverty involves deprivations in various aspects of life, including health, education, and living standards. So multidimensional poverty acknowledges that people can be poor even if they have reached a certain income level, but because they have a lack of access to other necessities. So we need to look beyond income-based definitions. Therefore, a suggestion could be an expansion of looking into other indicators that capture the qualitative aspects of poverty, such as food security, nutrition, quality of schooling, advanced healthcare. Second, we can look into strengthening social protection for the self-employed. We know that the rate of voluntary contribution for the self-employed has been rising in recent years, but there can still be improvements made. Recently, we looked into the expansion of sectors for the self-employed that are mandated to contribute to Social Security, such as the passenger transport sector in 2017, the delivery of goods and food in 2022, and most recently, the hawker sector in 2025.
Thank you very much, Shazrul. Well, there's lots to think about over there, and while we do that, let's move on to Chapter 2. Chapter 2, From Necessities to New Norms, looks at how COVID-19 reshaped household expenditure in Malaysia. And here to explain it to us is KRI's Dr. Teo Aini. Aini, please, take it away.
Thanks, Xiaolong. Chapter 2 of the SOH 2024 report looks at household consumption trends and examine how the pandemic affected how households spend on certain categories, including on food. There are certain findings that I will highlight today, mainly three. The first is to look at how, despite slower income growth, household spending continued to grow, taking up higher shares of income. In 2022, households spent an average of 77.6% out of their disposable income, a significant growth from the previous year, which recorded an average of around 63%. Now, this is despite the Chapter 1 findings that the income growth among Malaysian households have slowed down significantly during the pandemic. But with this, household spending continued to increase. This will undoubtedly exert a greater pressure on cost of living and take up a higher portion of the disposable income, which can be saved up or reserved for other essential purposes, such as savings. The second findings I would like to highlight is how post-pandemic Malaysian households spend nearly 48% or about half of their total food spending eating out, ordering food online, or getting takeaways. This is as comparison to 20 years ago, Malaysian households spent nearly about 33% or 33 to 34% on food away from home, with about 2/3 of their monthly food expenditure cooking at home. And this is a stark comparison, especially after the pandemic. This is not surprising given how our food service establishments have rapidly expanded over the years. The most profound change is observed after the pandemic in 2022 in how households increasingly rely on food away from home as a source of nutrients and calories. The third findings I would like to highlight is how household spending on outside meals has been rising even after accounting for inflation. Now, if you look at food at home first, which we used to primarily rely on, the total money that we spend, or in nominal terms, the household spending on food at home, which means groceries and food items that we prepare and cook at home, has been increasing due to inflations that we see, where we have every year that lead to price increases. But at the same time, the real spending, which we take into account inflation, the effect of inflation, has remained stagnated. So for food at home, Malaysian household has been spending more money, but essentially getting the same amount of food. But we see a different observation for food away from home. For Malaysian household, there has been spending more money on food away from home in both nominal and real or inflation-adjusted terms. This suggests that households are not only spending more money, but are also buying more in greater amount or opting for the pricier options when they eat out. It can be from night market, street stall, informal household who sell their food to other Malaysian families. It can be from formal food retail and food services establishments such as restaurants, cafes, and bakeries. This is essentially a very interesting findings because it shapes that Malaysian change to food away from home is not because of price increases. Because despite price increases, Malaysian households continue to spend more and dining out more often than cooking at home. And this reflects a fundamental change in how households acquire food and possibly indicates that convenience of eating out has outweighed the benefits or what people used to enjoy from cooking at home. And that summarized the 3 key findings of Chapter 2.
Well, those are some very interesting findings, Aini. It sounds like the appetite of the Malaysian consumer for food away from home remains undaunted both by pandemic challenges and also rising inflation. So tell us what it means. What should policymakers do with this kind of information?
Thanks, Shalom, for the question. Before I give some policy consideration and suggestions about this food eating out and trend, we must first understand the implications of increased reliance on food away from home, especially on cost of living and health. For cost of living implications, eating out has been more expensive in general than cooking and preparing your meals at home. If you look at Consumer Price Index or CPI of food at home and food away from home, the CPI or the prices of food away from home has remained higher than food at home over the decades or the longest time that we have known. And in recent months or years, we see that the inflation or the inflation rate of food away from home has remained higher than food at home. What this means for Malaysian households is that if they want to continue eating out, they will have to bear a higher cost of living pressure. And this will eat into their already, for many Malaysian households with wage stagnation, this will eat into their very limited disposable income that they can have for other essential purposes such as savings. And like I said before, this eating out trend is not just a passing trend, but a fundamental change in how households acquire their food. And it's driven not because of the desire, not entirely because of the desire to have greater diversity or for greater taste of food away from home, but also largely by the need for convenience food options and the lack of time to prepare and to cook food at home. Now, the second implication is on food safety. Eating out is the most common context for food poisoning and foodborne illnesses. In Malaysia in 2023, about 54 food poisoning cases happen for every 100,000 Malaysians. And this figure has been increasing in the past few years. And this food poisoning cases that is reported by the government shows that the most common occasions for these food poisoning cases are in out-of-home settings, such as in school, institution, restaurant, pasar malam, night markets, and also street stall. With our increased reliance on food away from home, This will also increase our chances of getting foodborne illnesses or food poisonings due to eating unhygienic or improperly prepared food away from home that we get in out-of-home setting. Another health implication that we may need to consider with this increasing reliance on food away from home is the health implication associated with food away from home. Food away from home options can be diverse, but the more popular ones tend to be prepared using unhealthy cooking methods such as deep frying or heavily seasoned to appeal to the masses. Eating out more often has also been associated with higher consumption of salt, sugar, fat, and also high energy, which all of them are associated to some non-communicable diseases many Malaysians are already struggling, such as diabetes, high blood cholesterol, high blood pressure, overweight, and obesity. Now, this food away from home can be obtained relatively easy from many sources, but with online adoptions, such as online food delivery services, has now become an essential tool in our daily life, the occasions for eating out will only increase from now, and this will also contribute to the overconsumptions of energy and the unhealthy nutrients that I mentioned just now, because of the ease of getting food delivered to your doorstep. And the second consideration is also the increased consumptions of food away from home through convenient options such as online food deliveries and others can also increase the risk of sedentary lifestyle, which many Malaysians are already struggling with, and this will contribute further to the non-communicable disease burden among Malaysians. So go back to Xiaolong's question about what are the policy options or implication of this eating out trend. Because of the cost of living and health implication that we have to consider from this eating out trend, first, for the cost of living, policy aim to target the high cost of living or to mitigate the prices of rising food costs will have to expand their focus from just household food items such as groceries to also out-of-home food items. One such initiative that we have is Menu Ramah, but there are plenty of rooms for improvement to improve in terms of its coverage and also, more importantly, the healthiness of the food served under the Menu Ramah program. Because ultimately, we want to create a healthier out-of-home food environment that promotes not just affordable, but also healthier options for Malaysians when they eat out. And second, the food-related initiative and assistance for lower income should also take into account the increased reliance on food away from home options as a need for convenient and accessible food in this current society. So Food Poverty Line Index should take into account the cost of eating out, not just the cost of preparing food at home, to better reflect household evolving needs and also to have a better estimation of poverty in Malaysia. To tackle the health implication of food away from home, there must be greater efforts to promote better awareness for Malaysian individual and household to choose the safer and also healthier options when they are dining out, especially when we tend to be overwhelmed by a diverse options, which unfortunately also tend to be less healthy. And but more importantly, we need to undertake a more comprehensive package of food environment policy, including monitoring, guidelines, labeling, and incentive for consumer to opt for the healthier and safer options when they are dining out, whether at formal or informal settings, including night market, hawkers, restaurant, cafe, bakeries, both informal and formal, to ensure the affordability and accessibility of healthier and safer options. And this summarizes the policy recommendations that I would like to raise about this food away from home trend.
Thank you very much, Aini. It sounds like the Malaysian consumer needs a lot more guidance on health, nutrition, financing, as well as adapting to changing lifestyle pressures. With that, I think we conclude the findings from Chapter 2 and we move on to Chapter 3. Chapter 3, From Blackboards to Broadband, looks at education outcomes and digital learning during COVID-19. And here to explain the findings as well as the policy recommendations to us is one Amira Wanasama, one of the co-authors of Chapter 3. Amira, please take it away.
Thank you, Xiaowang. So, school disruptions are among the unintended consequences of the COVID-19 pandemic. So essentially during the pandemic, we had a lot of social distancing measures, things were shut down, and that included schools. And the association between schooling disruptions and negative impact on learning is not new. And we've seen this in past pandemics, as well as past large economic disruptions. And one of those outcomes is this increased dropout rates. And what we see over time and more recently is that between 2016 to 2020, the gap between the number of students that are enrolled in Form 5 and those who are registered for the SPM examinations, as well as those who are present in on the SPM examinations, were decreasing. But we see this take a turn for the worse from 2020 to 2022, where there is a larger gap between those who are enrolled in Form 5 and those who are actually present for SPM examinations. And the reason for this is that as children grow older, the opportunity of staying in school rises. So essentially, it becomes more challenging for households, especially for those who are under financial strain, to justify sending older children back to school after interruption. As we have to remember, COVID-19 also disrupted a lot of livelihoods. So for those who have children that are able to work and may not necessarily do well in school, it made more financial and economical sense for them to leave school and start working. And we have a lot of learning loss happening during the pandemic, and this would also impact or influence their decision on whether or not they were to stay in school. So we do see, in general, past studies found that any interruption in schooling, including those that are scheduled, led to some form of learning loss. And we have two types. So you have the learning forgone. That means things that you were able to learn that you were not able to because of these disruptions, and the learning that you have forgotten. And you can also experience both. And this is probably what happened during the COVID-19 schooling disruptions. So they were not able to learn things that they should be learning during their education, and they might have also forgotten things that they've learned previously, leading to greater learning losses. So Malaysia, during the pandemic, experienced about 41.5 weeks between mid-February 2020, when some of the school closures started, all the way to July 2022, where we still had some disruptions here and there. We have a total of 72 weeks when we include partial closures. So these were regions that might still have spikes in COVID cases and therefore were closed, or maybe the schools themselves, even though the region did not have any instruction to close, but because the school had an increase in pandemic cases, they were forced to shut down. So we have this all over, especially in urban areas when there's a lot more students and therefore a lot more potential cases to spread. And the correlation between the length of school closures and academic loss can be seen in the most recent PISA scores. And we see in the chart for reading, mathematics, and science. What we did is we compared each country's average scores and the change between 2018 to 2022. So essentially the change in PISA scores before the pandemic and after the pandemic. And what we see is that there is a trend. The longer the schools close, the lower the drop in scores, solidifying this correlation between schooling disruptions and academic learning loss. But learning loss itself is not only academic. So a lot of learning sort of happens in classrooms with interactions with other students. So for example, socio-emotional learning, how you learn with other people whenever you have group projects, all of that is lost when you take it to virtual learning. Another challenge was equal education opportunity. So things moved digitally, but not everyone had similar access to digital things. So we can think about your internet, the level of stability. We also think about your digital devices. Do you share? Do you have your own laptop? Do you have to rely on tablets? All of that is all of this equal education challenges becomes more pronounced when we move to digital, versus when everyone's in school, you have that same desk, same chair, same book, same teacher. Now you still have the same teacher, but everything else have changed. And learning loss itself is cumulative. And this is the question on, well, COVID's over, everyone's in school. So does this even matter? Yes, because if you don't address past learning losses, future or prolonged learning losses can still happen. So what you learn in Standard 2 is based on what you learn in Standard 1. And what you learn in Standard 3 is based on what you learn in Standard 2 and Standard 1 and so forth. So when you have education disruptions in the beginning and you are not able to address it effectively, it becomes harder for the student to catch up in more advanced years. And we see this happening during the Pakistan case. So what happened in Pakistan in 2005, there was this large earthquake. And even after 4 years after the event of that earthquake, school-aged children who lived near the fault line where the earthquake happened performed worse in school. So these were losses that were happening even beyond the schooling disruptions of that earthquake. And the idea is because at that time, and this is also similar to Malaysia, you progress regardless of how you did in your grade. So it doesn't matter if you didn't pass Standard 1, you had to go on to Standard 2. So students were learning more, or they were forced to advance, but they didn't necessarily have the basics in order for them to study or learn effectively the more advanced subjects. And therefore, we have this future learning loss or prolonged learning loss that happens if we do not rectify the current losses that have currently happened. And so we do recognize here how learning loss can prolong even after school closures and why it's very important for Malaysia to address this learning loss now.
Well, thank you, Amira. It sounds like with education, we're very much facing a contradiction where the pandemic may be over, but the pandemic is still very much with us in terms of its lingering effects. So what can government policy do to try and resolve that contradiction and move beyond it for the benefit of the children?
Yeah. I think one thing that MOE does recognize is that this is a challenge, and they have stated it so explicitly in their 7-year strategic education plan. But what they didn't really outline in there was ways to sort of address this. So they know it's a problem, but there wasn't as much steps to address this problem. And of course, we can say that one of the main policy considerations or recommendations really is to enhance the education recovery to address these learning losses. But how do we design these education recovery programs really relies on the data collection and early warning systems that we have to design and curate for these at-risk students. Because right now, we don't really have much visibility on how students are performing. So recently, the MOE has done a literacy and numeracy exam for those who are in Standard 1 and Standard 2. But we don't really have, as researchers ourselves, we don't really have much access to this data. So it's hard to say, actually, what else to recommend other than just more intensified efforts and meaningful efforts to recover education, as well as just data collection and early warning systems for these students.
Okay, it sounds like it's going to be a tough and ongoing problem. I know Malaysia had one of the longest closures, but we're not alone in struggling to come up with a solution. I remember speaking to educators in Switzerland who told me that they've yet to come up with a plan as well. At the same time, there's no excuse not to do anything, and I think KRI will probably continue to look at this issue and try and come up with some good recommendations for further action. Thank you, Amira. Chapter 4 of the report on health and digitalization looks at solutions for the pandemic and beyond. And here to explain it to us is Ilyana Mukriz. Ilyana, please.
So thank you so much, Xiaolong. Following on the topic of digitalization in education, which was talked about by Amira just now, this chapter really focuses on digital access to digital technology in Malaysia during 2019 to 2022, and takes a future-facing approach in terms of applications of digitalization in healthcare services, i.e. digital health. So the first key finding of this chapter was that despite there being a significant growth in digital technology access, the urban-rural gap still persists. So here on the graph, you can see that although household access to internet, computer, and smartphone, there's a gradual closing of the digital divide between urban and rural, there's still rural areas still lag behind. So you can see for computer access, there's a marked closing of the digital divide from 27% to 12%. However, access to computers still remains lower compared to internet and smartphone. This sort of implies that a lot of the rural population are relying on mobile devices and mobile broadband to access the internet, and this may not be conducive for example, online learning, which may require a little bit more better connectivity. So a second thing that I want to highlight is that digital use was on the rise even pre-pandemic, and it continued to rise, particularly in 2021 at the peak of the pandemic. But this use was not sustained evenly, especially across age groups. Financial consumer behavior such as internet banking and e-commerce buying was on the rise before the pandemic and on towards 2022, and the share of the population using digital technology to apply for jobs also increased from 2021 to 2022. However, after the pandemic, although these uses were sustained within those who were aged 50 and below, it was not sustained for those who were a bit in the older age groups, especially for those above the age of 60. So this implies that a lot of the older generation are actually more comfortable with conducting their daily activities offline instead of online, unless absolutely necessary. And the third point that we would like to highlight from our chapter is zooming into something that was pretty important during COVID-19, and that was looking at health-related digital use, which spiked in 2021 and then decreased markedly post-pandemic. You can see in the graph that internet use for seeking information and making health appointments really went up between 2019 to 2021, and then it decreased markedly afterwards. And the rise in making health appointments online could be due to the launch of the MySejahtera vaccination module in February 2021. And actually, MySejahtera became the main mode of application for the vaccination. So this sort of explains why a lot of people came on board to making their health appointments online. However, afterwards, when endemicity was announced in March 2022, there was no need for the use of MySejahtera anymore, and there was no need for people to be making their health appointments online. You could come to the clinic like normal, and this would explain the decline that we see as well in these graphs. But we can see the potential of the Malaysian population in embracing digitalization during the COVID-19 pandemic. So for example, in 2021, MySejahtera had one of the highest open rates and penetration rates compared to the top COVID-19 applications worldwide, which means that across the globe, MySejahtera was the #1 most downloaded and most used COVID-19 application. So we really were able to jump on board when the time came to it. But in post-pandemic times, the use of MySejahtera was very significantly reduced, and it faced public resistance due to issues of data security and governance, which means it highlights the need for laws and legislations that really protect the end user or the sensitive health data that is covered within the application. Yeah, so those are the key findings.
Okay. Thank you so much, Yana. So given that changing landscape of digital adoption and very much an increase, what can the government take away for this for future policy interventions in closing the gap?
Yep. So I think I'll highlight two main policy recommendations. The first being that we really have to expand initiatives that ensure there is equitable access to high quality connectivity for all. So we have a mission to become an advanced digital economy, right? So in ensuring this, Malaysia has to make sure that everyone has equal access to digital technology and connectivity. An equalized quality of access would uplift communities on the fringe especially and allow them to realize their potential through the full gamut of benefits that digital technology can bring. And it would also reduce the asymmetry in terms of between urban and rural populations, as well as the uneven economic development in these areas. The second main policy recommendation is that we must ensure that whatever digital solution that we develop for our nation is catering to all segments of the population, not just a few. So this is not just about access, but about whether the solution is usable or not. With many of the Malaysia's public infrastructure embracing digital technology, we must make sure that no one is left behind. And as you saw from our key findings, there are certain groups that are more able to or more willing to come online or go digital versus others. So it's important to ensure that whatever digital solution that we choose, for example, MySejahtera, it's user-friendly for one, and for second, it should cater to those who we don't typically consider as digitally savvy. How are they able to benefit from these digitalization solutions? And it's also important to remember that these digital solutions should be secure and also well governed in order to ensure that people want to buy into the digital solutions and they don't just die off and become a bad investment. So thank you.
Okay, so a diversity of user profiles and airtight digital security. Very, very important. Data privacy.
Yep.
Okay, thank you so much, Yana.
Yes, thank you.
Thank you everyone for tuning in to our State of Households webinar for 2024. We really appreciate your attention and we welcome any questions. Even though we're ending the live stream, please type yours in the chat box below. You can also reach out to us at KRI events at kriinstitute.org. And for the full report, you can download it from our website, www.kriinstitute.org. And we look forward to receiving any feedback that you may have. Thank you and have a good day.